The development of the toolkit was a very thoughtful, lengthy process that involved a lot of thought and resources. It was another example of RPA's dedication and commitment to this process. They brought together many practicing clinicians, doctors and practice managers, policymakers, and then the Center for Clinical Health Policy Research at Duke was involved in that stage as well. So people who are experienced with evidence-based medicine, with clinical guideline development, with implementation research, which is the people who are at our center, who are not necessarily nephrologists, some were not, but different perspectives were all brought together to come up with these set of tools that were felt to be feasible, felt to be helpful, and to really help facilitate rather than add to the burden that we have on a daily basis. And in fact, I think they succeeded. I really do.
There are several elements that are terrific. Number one, the yellow patient flow sheet, which has a place for all the patient's medications on one side and a summary of their laboratory data and a little place to put notes. The patients love those, and we have them everywhere in the office.
It gave us a structure and a process which the value of which is very difficult to articulate. I mean, it collapsed perhaps what would have taken us months or years into a process where we sat down and in a couple of meetings agreed to a more uniform approach.
Primarily with the staff, it's taken them to a different level of understanding nephrology. And that's been a pretty exciting process to witness.
I think it provides a lot of options for the practices to kind of advance this whole movement, if you will, of the patient being more educated, knowledgeable about their kidney disease and their options. Then they're going to be more adherent to the care that's suggested to them because they'll have a better understanding of it. And it also focuses the doctors more on what the goals of care are for these patients.
The most useful aspect that we have found in the toolkit has been the patient diary. It basically involves the patient in their care, and at the same time we stress the importance of adjusting lifestyles and in personal responsibility for their care in all stages of chronic kidney disease.
One of the biggest fears is having certain patients fall through the cracks and not having the systems in place to have the reminders and have our practice really on top of what the priority should be with those patients. So I think the ability to translate the tools from the toolkit into an electronic medical record system will be the best ways for us to capitalize on the tools and use them almost every day as we care for our patients.
We will take the lessons learned from this project and apply it to really help shape future policies. RPA is very dedicated and has shown this for many years to find ways to help its members and other nephrologists improve the care of chronic kidney disease patients. By the time we finish this study, we should have a better idea of how this particular toolkit can be implemented nationwide, and also how do we deal with the changing landscape of electronic health records and health IT information technology. We are giving thought to how we can adapt to a changing environment, but we don't have all the answers yet.